World Geography, Africa, Disease. Here are the learning objectives. 1. How are HIV and AIDS related to one another? 2. Describe the most common African tropical diseases. 3. Compared to other African diseases, what makes Ebola so much worse? Human immunodeficiency virus. HIV/AIDS. Acquired immune deficiency syndrome, or AIDS, is a life-threatening infectious disease caused by the human immunodeficiency virus, HIV. So HIV causes AIDS. What HIV does is it hijacks the immune cells, which are called T cells, and it impairs and destroys their functions. This weakens the body's ability to fight off any other disease that comes along. When the immune system can no longer fight infections at all, then the disease has progressed to AIDS. Global impact. AIDS was first reported in the United States in 1981. However, most people trace it back to the 1800s in Africa. HIV/AIDS is now a major worldwide epidemic. 34 million people were living with HIV at the end of 2012, and 1.7 million died of AIDS in 2012. 2/3 of new HIV infections are in sub-Saharan Africa. Minority populations are hardest hit in the United States. Transmission. HIV is transmitted by the exchange of bodily fluids, or blood, between an infected and uninfected person. The specific means of transmission include unprotected vaginal or anal sexual intercourse and oral sex. 2. Tiny tears in the skin or the membranes. 3. The transfusion of contaminated blood or the sharing of needles. And 4. It can be passed from mother to child during pregnancy or breastfeeding. Safe activities. HIV is not transmitted through hugging, kissing, or shaking hands. It is not present in saliva. HIV symptoms. The first sign of HIV infection, when you first contract it, you feel like you might have a flu-like illness a month or two after the infection. However, HIV can multiply in the body for years with no physical symptoms at all. So without medication, persons with HIV, they may not be diagnosed with AIDS until 10 to 15 years after initial infection. AIDS symptoms. Opportunistic infections that affect people that have advanced HIV or AIDS include things like tuberculosis, herpes, yeast infection, cancers, pneumonia, and wasting syndrome. Prevention. So there's no vaccine to prevent AIDS. So what are some methods that can be used to slow down the transmission or prevent it altogether? Some things that you can do is the use of condoms. Male circumcision slows down the rate of infection. Avoid contact with blood and use clean needles. Also, pregnant mothers should receive treatment for HIV. And newborns should receive treatment too with antiretroviral medications. Treatment. There is no cure for HIV/AIDS, but antiretroviral drugs, they can keep the amount of virus in the blood low. Combination therapy is most common, where they use 3 different antiretroviral drugs. And this therapy has cut the AIDS death rate in the United States by nearly 50%. It hasn't cured anyone, but it has cut the death rate. Drug resistance is a growing problem in the treatment of HIV. Malaria. Malaria is a parasitic disease transmitted between humans by the bite of an infected mosquito. A parasite is an organism that lives in or on another organism and benefits by deriving nutrients at the expense of the host. Malaria can cause flu-like symptoms and attacks of fever and chills. It's curable, but it can become deadly if it's left untreated. Global impact. Malaria has been eradicated in countries with temperate climates, like the United States, but it remains prevalent in tropical and subtropical climates. About 40% of the world's population lives in these areas, and so they are at risk of contracting malaria. Each year there are over 250 million malaria cases and over 880,000 deaths. Malaria is particularly deadly for African children. Causes. When a mosquito bites an infected person, what it does is it ingests a form of the malaria parasite. And then this parasite completes its life inside of the mosquito. Once it's gone through a certain stage, it makes its way to the bug's salivary glands. And then when the infected mosquito bites an uninfected human, it injects the parasite into the human's bloodstream. The malaria parasite then migrates from the bite site to the human's liver, where a new form of the parasite then infects the red blood cells, which then multiply and rupture. Symptoms. The symptoms of malaria can include fever, chills, sweating, headache, muscle pain, vomiting, diarrhea. Severe complications, anemia from the destruction of the red blood cells, kidney failure. Prevention. There is no effective vaccine to prevent malaria. Prevention methods focus on reducing the transmission of the disease by the infected mosquito. So the main interventions can be indoor spraying of the walls or the homes with insecticides, the use of mosquito nets at night to protect people while they're sleeping, and the reduction of standing water where mosquitoes might breed. Treatment. Medications are used to attack the parasites in the blood, but parasitic resistance to the most common and affordable malaria drugs is increasing, and so it's undermining the efforts to control this disease. Diarrheal diseases. Diarrheal diseases. Diarrheal diseases include things like cholera, dysentery, typhoid, and the rotavirus. Diarrhea can be caused by bacterium, viruses, or parasites, and they can be spread by a lack of proper sewage and clean drinking water, poor personal hygiene, living close to animals, and a lack of food refrigeration. Symptoms. Severe diarrhea indicates that the body it's not absorbing enough water, and there's a loss of a large amount of fluid in a short period of time. This causes dehydration. Other symptoms of diarrheal diseases include things like nausea, vomiting, cramps, hypovolemic shock, extreme drop in blood pressure, oxygen reduction. Prevention. Preventative efforts to prevent diarrheal diseases focus on good sanitation, access to safe drinking water, and eating food that has been thoroughly cooked. Mothers are encouraged to breastfeed babies to provide them with an uncontaminated meal. And there are some vaccines for some of the diarrheal diseases. Treatment. Diarrheal diseases can be cured with rehydration salts that help replace the lost fluids. In more severe cases, intravenous administration of fluids may be needed. Diarrhea caused by an infection can be treated with antibiotics. Ebola. Ebola hemorrhagic fever. Ebola hemorrhagic fever is severe and deadly. It's found in humans and then non-human primates, monkeys. The disease itself is caused by the Ebola virus. The exact origin, locations, natural habit of this virus remain completely unknown. Confirmed cases, though, have been reported in the Democratic Republic of the Congo, Gabon, Sudan, the Ivory Coast, Uganda, and now in 2014, it's been found in Guinea, Liberia, and Sierra Leone, a real epidemic. Facts. Ebola virus appears in sporadic outbreaks, now and again. It's often spread within the healthcare setting. Infections with Ebola virus are acute. That means they're of short duration and severe. Researchers have hypothesized that the first patient becomes infected through contact with an infected animal, but they really don't know what that animal is. Transmission. After the first person is infected, the Ebola virus can then be transmitted in several ways. People can be exposed to the virus from direct contact with the blood or other secretions of an infected person, or through contact with an object that was just touched by an infected person. A dead body of someone who's had Ebola is still contagious. Symptoms. The onset of Ebola hemorrhagic fever is abrupt and is characterized by fever and headache, joint and muscle aches, sore throat, diarrhea, vomiting, and stomach pain. Treatment. There is no standard treatment for Ebola hemorrhagic fever. Patients can receive only supportive therapy. You can balance the patient's fluids and electrolytes, maintain their oxygen status and blood pressure, treat any complicating infections. Prevention. The most effective method to prevent the spread of the Ebola virus is to use barrier nursing techniques. This means that in the hospital, everyone wears protective clothing, masks, gloves, gowns, goggles, everything. Complete equipment sterilization. Everything must be sterilized. Infected persons must be isolated from contact with unprotected persons. All contact with the body of a deceased patient must also be prevented. The chance of dying once you have contracted Ebola is about 90%. So this is an extremely deadly and contagious disease. The end. Thank you for listening. Thank you for your attention.